Hi, I'm Dr. Ramsey. Welcome back to Everything Hormones. Today I'm going to review an article that was posted in the New York Times, not an article, just a paper, a write-up in the New York Times on June 15th. But I always start with a prayer. Dear God, thank you so much for supporting me for 30 years, practicing hormone replacement therapy for both men and women, and bringing all wonderful patients to me, even as early as 1996. Now we're at 2026, and the world is blowing up with wanting hormones. And so thank you for bringing me this article to clarify even more to people interested in this beautiful medicine. In Jesus' name, amen. June 15th. 2026, the New York Times. The title of this paper is Millions of Women Are Left Out of Menopause's Moment. Women who can't take hormone therapy because of breast cancer or other diseases say they are deeply frustrated. A 46-year-old woman has been hearing about hormone therapy nonstop. Whether it is her friends going through menopause or posts from influencers on her social media feed, the subject has seemed unavoidable. Who was on it, which doctor finally took their symptoms seriously, and most importantly, how good it felt to be on the medication. The hot flashes waning, brain fog lifting, sleep returning. You know, this is so, if you've been following me, exciting to me because for 30 years I've been fighting an uphill battle, especially with physicians who don't understand what I do, and I don't expect them to without being exposed to the research like I have been blessed, and many others, by Dr. Rouzier. If you want to know more about Dr. Rouzier, there's an older podcast where I interviewed him. Take a look at that. To her, it sounds like a miracle drug, but for her and millions of other women, it is not an option. She was diagnosed in 2023 with a type of breast cancer fed by estrogen. And I love that line because normally you hear it's caused by estrogen. Truth is, if there's a DNA damage in the breast cell, it is fed by estrogen. That's the only time I take women off is when they have an active cancer. So that was a beautiful line. And now she takes a drug that suppresses a hormone to reduce her risk of recurrence. So that's an estrogen blocker. We've talked about all of these things. And the unfortunate thing is that estrogen blockers do not reduce breast cancer risk. It's what they have to prescribe. I hate to go against mainstream, but unfortunately, mainstream's not reading the research. There's one fact that I meant to say in the last podcast when we talked about estrogen and breast cancer is the longer our breast cells are not exposed to estrogen, the more resistance it's called. It's like insulin resistance at the cell level of the breast, which is very inflammatory. So blocking estrogen not only doesn't reduce recurrence, it causes so many symptoms of estrogen deficiency we've talked about. While her breast cancer is the most widely recognized reason women may not be able to take hormone therapy. Is that true? For you listening, all of these years, does estrogen increase the risk of breast cancer? If you don't know, please listen to my podcast on estrogen and breast cancer. Taking estrogen actually reduces the risk of breast cancer. And what's interesting to me is if estrogen itself was the vehicle that caused breast cancer, why would young women who have very high estrogen levels naturally, ovulating women who make lots of estrogen every month, why wouldn't they be at the highest risk of breast cancer? It's really postmenopausal women who don't take estrogen who are at the highest risk of breast cancer. So as you know, breast cancer is not a contraindication in my practice. And I wish maybe the next time the New York Times prints something, it's going to be a little more accurate. So I'll say that again. While breast cancer is the most widely recognized reason women may not be able to take hormone therapy, false, which delivers estrogen or progesterone through pills and patches, the list also includes, these are contraindications for estrogen therapy, endometrial cancer. Correct. Take the uterus out, give estrogen the next day. Totally safe. Certain cardiovascular issues. Well, the most protective thing for the heart is to take estrogen, which is why I give it to both men and women. Severe liver disease, well, in that situation, I'd give topical estradiol, which normally I give oral, and blood clotting disorders. Estrogen, Premarin, birth control, both increase clotting disorders, clotting risk. Bioidentical estradiol, both topical and oral, actually reduce clotting risks. It's totally different, and I know it can be confusing. What's bioidentical and what's synthetic are very different stories. But from today, I just want to clarify that all the reasons listed that women should avoid estrogen or estradiol replacement therapy, in my opinion, from the research, so it's really not my opinion, are false. So she and other women said they feel deeply frustrated. They can't take hormones that so many women around them seem to have benefited from. Well, anyone listening, you can. The messaging about HRT is so positive and all consuming right now. She said, it seems like you can experience this phase of your life totally differently, and there is relief. Absolutely. But she says, I feel totally cut off from that. Another 46-year-old woman cannot take hormone replacement therapy because it raises the risk of blood clots. We just went over that, which is already more likely to develop because of a genetic mutation that she carries. If a woman has a genetic mutation, a clotting disorder, you can use topical estradiol without ever causing a blood clot. Even topical Premarin, which is synthetic, will not cause a blood clot. Oral, because it goes to the liver, increasing clotting factors of synthetic estrogen will increase clotting factors, but estradiol will not, orally or topically. At a recent family party, she started commiserating with another woman about perimenopause symptoms, which for her, she has included night sweats and hot flashes. They were half complaining, half laughing when the women became serious. She had wasted 2 years suffering before starting hormone therapy. She told her it had fixed everything. I immediately lost connection, and I felt isolated, though. There are other options to treat some of these symptoms, but because of a lack of awareness, doctors don't suggest them, and patients don't often know about them. And what they're referring to, but didn't say, is there is an herb you can get at the health food store to treat hot flashes called black cohosh. That's the active ingredient. There's many different brands. Like when I was first out of school, I used Remy Femin, which is a black cohosh. Whether that's on the market, I don't know. But you can buy these over-the-counter products for hot flashes if your doctor refused to give you estradiol. If you're suffering from hot flashes, that's all it treats. A gynecologist recommended an herbal supplement, black cohosh. It doesn't say that here, for hot flashes. She also suggested avoiding caffeine, limiting hot beverages, and sleeping with a fan on. The supplement has helped slightly, she said, but definitely has not eliminated the hot flashes. The dietary changes help somewhat too, but come with what feels like constant trade-offs. No morning cup of tea, less sugar, no fun. She says, I have to work hard to feel better, struggling through it all, while other people get to slap on a patch and live their best lives, she said. And for those of you who are struggling because you've been told that you can't take estrogen, I feel for you. And we're here to help you. And hopefully other doctors are learning this now as all of the news comes out from the FDA saying estrogen doesn't cause breast cancer. So just know the reason I'm sharing this with you is estrogen really is for everyone. I recognize it's not that simple, but it is how it feels, she added. Of course it does when you're told you can't take something for a deficient state. A professor in Washington, D.C. said her doctor advised against hormone replacement therapy because she has at increased risk for stroke. And I haven't said this much. There's not been a lot of articles, but there's been a handful that show estradiol, bioidentical estrogen for females, reduces stroke. We've never seen a stroke, heart attack, blood clot from estrogen in our practice in 30 years. She said that when she tried to raise the subject with her providers, she hit a wall. Through no fault of their own, they're like, we're trying to have you not have breast cancer. So they're holding treatment to prevent her from getting breast cancer, which is the opposite of what happens. It feels like you hit a dead end. I get it. There's a humongous provider knowledge gap when it comes to menopause care. The director of Comprehensive Menopause Program at UCLA said, while demand has exploded, many clinicians are still not up to speed on the full range of treatments, including non-hormonal options. I'm not going to read this next paragraph. They're talking about 2 drugs. One was approved in 23 and 25. What these drugs do is they treat hot flashes by doing something to the brain like black cohosh does. Unfortunately, as I look these drugs up, they have a litany of side effects. Black cohosh over the counter for hot flashes has 0 side effects. So I'm not going to read that. Cognitive behavioral therapy can also be beneficial for hot flashes and sleep issues, and certain antidepressants and other drugs can be used off-label for hot flashes and lifestyle. In fact, if you remember in 2003, when the WHI, Women's Health Initiative, came out, what happened was millions of women who were on estrogen therapy were put onto Prozac, or actually it wasn't Prozac, it was a different antidepressant. I'm sorry, I can't think of the name, to treat hot flashes. And yes, you can take, maybe it was Zoloft, I apologize. But unfortunately, all these women went off hormones and on antidepressants. I say, no one else does, so they don't realize how bad they feel. And that's what they're talking about here. Most women who can't take synthetic hormone therapy can also use topical vaginal estrogen. That is true. It's a very low dose. It's a 0.01%, so it will treat the vaginal dryness. It doesn't treat systemic. Like every receptor of estrogen, I like to be filled. Like I visualize this in my patients. When they're filled, the DNA is getting the right message to create healthy cell turnover. We have so many other things in our toolkit, said medical director of the Menopause Society, which is a huge society that sets the standard of care for menopause. And we look at their updates every 10 years. And I think it was 2010 or 2011 when the Menopause Society finally put on their recommendations bioidentical progesterone. We all were so happy to hear low dose, but still, they went from synthetic progestin, which is so risky, to bioidentical progesterone. It's so nice to see all the growth that has happened. But very few women have heard of these options, which may be a reflection of how squarely the conversation around menopause is focused on hormone therapy. I would love it if any of the menopause influencers were like, hey, women with breast cancer, I know you're out there doing all the strength training and doing all the things. Bummer. Just acknowledge it. Another 46-year-old woman said, who cannot take hormone replacement therapy because she has a history of breast cancer. Alternatives to hormone therapy have helped, but juggling all of them can be taxing. She takes an antidepressant for mood swings, sleep issues, and anxiety, all things in my mind that hormones treat. And she gets this every 6-month osteoporotic injection. And she says she's in there with these 80-year-olds. She's 46. Well, I don't like those fake drugs. They cause fake bones. And guess what causes healthy, strong bones and reverses osteoporosis is bioidentical estradiol. She uses a cream to treat her vaginal dryness, including before having sex. Is there anything less sexy than saying, are we going to have sex tonight? Because if so, I need at least 30 minutes notice so I can do my vaginal moisture routine, she said. The idea of a single convenient pill or patch that can treat all of these issues at once is very appealing. She said that many of our friends talk about hormone therapy as absolutely saving their lives. I'm so glad for them, she said, but I'm also very jealous. Another doctor said the messaging around hormone replacement therapy has contributed to women feeling left out. The treatment is only approved to relieve hot flashes and night sweats and bone loss. That's true. But influencers and menopause care companies also tout it as a way to relieve all sorts of their symptoms, protect the brain and heart, and even slow aging. Yes. That can leave women who cannot take it feeling like they have missed out on the golden ticket. And that's where I want you to hear you don't have to feel left out anymore. And hopefully your doctor is becoming more educated so that you have better options than you currently have. So if you want to learn more, my book that came out last October, you can get on Amazon, Hormones 101, treatments your doctor wasn't trained to provide. And the reason I labeled that is just because of articles like this. If you're not studying the research, you're not going to know all of this. I'm grateful for the exposure, and I'm hoping that breast cancer women start realizing stroke women start realizing, blood clot women start realizing they can take hormones safely without having any of those risks increased. Thank you so much for listening. We'll see you next time. Have a great day.